Hey there, YouTube fans. How you going? I wanted to talk briefly about iron deficiency without anemia. I'm going to get the results of my blood test today, hopefully, and we'll see how I'm doing. I still have a lot of symptoms, but a couple of things. This is an article from Royal College of Physicians, Iron Deficiency Without Anemia, a diagnosis that matters. And I'm just going to jump right through just for 1 second to what I think is one of the most important things when it comes to the treatment levels that you should aim for. And it says here, cutoff, ferritin is an acute phase reactant that is increased in serum during chronic inflammation. So, for example, I've talked before about fatty liver, diabetes, heart failure, all these kind of things. High CRP levels, so high C-reactive protein levels, which you can test with a blood test. It all signals inflammation in the body. Now, when there's inflammation in the body, your body can raise hepcidin levels, which blocks your absorption of iron through the guts, okay? Now, the way around that is people like that, like me, because I actually yesterday had an ultrasound on my liver, and luckily the radiologist, I think they call them, shared with me, they're not allowed normally to do that I definitely have fatty liver. So my fatty liver, right, is stopping my ability to absorb these iron tablets and any other iron tablets, most likely because I'm not getting any benefit from just taking the iron. So I'm going to be pushing my doctor to try and give me intravenous iron again. I've already had one, and let's see if I need multiple IV irons. Now, going on with this article, cutoff values for ferritin in iron deficiency are increased to 100. I think it's that little micrograms per liter symbol, a little U kind of symbol, in states of chronic inflammation, which is what I just said. Transferrin saturation, TSat levels below 20% are also diagnostic of iron deficiency. Now, mine was 15 the last time we tested it, so that's a lot under 20. And in the past, it's been 18, I think 19, and it's never really come right up. In chronic inflammatory conditions, when ferritin levels are 100 to 300, and that little symbol mg/L or UG or whatever it is, TSATs, transferrin saturation, TSAT, should be used to diagnose iron deficiency. Pardon me. So, this transferrin saturation is very important in diagnosing iron deficiency because your ferritin levels is one of the things they check in iron deficiency can be elevated due to inflammation in your body. So, for example, if you have high CRP, like I said before, that's a really good signal that you have high inflammation. Now, the Greeks, there was a video on YouTube, a conference of Greek people, and they said if you've got chronic inflammation in your body, you need to be aiming for between 200 and 500, that symbol mg/L in the ferritin, and above 20%. Now, I've heard people say that for a guy, your TSat should be even as high as 45 for optimal health, because these lab values are for general populations, but you may feel not so good at the lower end of the lab values. Now, of course, always check with your doctor. I'm not your doctor. This is just for information purposes only. So that's the thing. The treatment goals for somebody with chronic inflammation in their body should be something like the high end of the reference ranges that we have in Australia. So, for example, 300 in the Ferratin and 45 for men in the TSats, and I think it's 35 for women. At the lower end, you may not feel great. I don't think there's actually. I can go through this one other thing here. These flow charts that they have, and I'll try and put this link down if I get a chance, but this Royal College of Physicians article that I'm looking at, it's A.L. Nassim is one of the contributors, and Salam, Sallam, is also one of the contributors. Now, there's a flow chart here to diagnose iron deficiency without anemia. Is the patient suspected of iron deficiency? Tick yes. Okay. Check the hemoglobin levels. Okay. Down again. Yes. They're normal. Okay. So you go and you check the ferritin and the TSat levels. Okay. Well, they're good. Does the patient suffer from a chronic disease? Yes. Is the ferritin under 100? Mine was something like 40 to 50, 52, something. So that's me. Yes, I'm under 100. Goes over here on the table. Yes. Good old teacher Sal has iron deficiency without anemia. There you go. I love this chart. I'm going to show my doctor hopefully today this one. On this article, they also talk about what the causes are for iron deficiency anemia. I won't go into that. There's many causes, including, a poor diet, uptake, you need more, you're bleeding, things like that. So that's not what this video is about. Now, this other chart, which I love, I'm still tired. Here are some of the symptoms. Central nervous system, headache, yes. Absent-mindedness, yes, that's me. Cognitive function down, yes, that's me. Fatigue, I've been whinging in every single video for the last several years, yes. Depression, yes. Sleep disturbance, yes. Impaired memory, yes, terrible. I can't even remember sometimes if I've taken my medicines or washed my hair when I'm in the shower. Heart palpitations every single day, yes. Exercise intolerance. Yesterday, I kid you not, I had to change the mattress protector on my bed. It's a queen size bed. So I had to put that on and take the sheet off that was on there. And so put that under the sheet and then put the sheet on. And by the time I did that, I had to get into it. I had to get into that bed for half an hour. I'm not joking. Just couldn't handle it. It just wiped me out. Just changing literally 2 sheets. Unbelievable. Okay. Exercise intolerance, we said. Shortness of breath, yes, every day. Hair loss. Well, I haven't got any hair to begin with. Pica, which is, you crave ice or you crave dirt or things like that. I didn't seem to have that. Weight gain, well, look at me. I can't seem to lose a lot of weight in a hurry. Muscle and connective tissue, muscle and joint pain, yes. Dry skin, absolutely. Weakness, yes. Restless legs, this is really weird. I get restless feet, but I used to have restless legs all the time when I was even younger. So that's very telling. I think I've had this problem for decades. And it says here exercise tolerance again, which is interesting. They repeated it. So those are some of the symptoms. I have most of them. I mean, all except really one. Another great chart I see here is, okay, so diagnosis of iron deficiency without anemia. Does the patient have chronic inflammation or irritable bowel disease, or they had gastric bypass? So in my case, yes, chronic inflammation, so yes on the chart. Go straight down to IV iron. That's intravenous iron, and referral to a specialist, which is a hematologist. Right? IV iron and referral to a specialist. It's like, do not pass go, do not collect $200. Iron tablets. If you have a chronic inflammation problem in your body, iron tablets are almost useless. You can't absorb them. This is why I'm not feeling much better. I need to have more IV iron, I believe. Well, let's say you don't have chronic inflammation in your body. The dietary advice, according to this article, is 28 to 50 milligrams of elemental iron daily, 28 to 50 daily, or 100 milligrams on alternate days for 25 days. Now, I've read other places where 25 days is not enough, okay? Telephone consultation once a week to discuss adherence and tolerance. Is the patient tolerant? Yes. Continue treatment course. Repeat blood tests every 6 to 8 weeks. Okay, well, I have had a blood test in 6 weeks, but you could test earlier than that. Dr. Soapy, I talked about some of his articles. It was every 30 to 60 days you could test your blood test. You can do iron studies again. Follow up with repeat blood test every 6 to 12 months. Now, this is assuming that you have corrected the problem. So if you don't correct the problem, say you got, the worst thing is gastrointestinal bleeding. So you have polyps or, God forbid, cancer or something like that. If you don't correct the problem, you're always going to have this problem, of course. I took IV iron. I have only had 1 gram, so 1,000 milligrams over about 6 weeks ago, and it's called Ferinject, Ferinject. I had the 2 vials into 1 bag of saline, which I said was 1 gram in total, 1,000 milligrams that is, and it says here it's determined based on the patient's body weight. So I'm double the body weight of most men. You would assume that I need double the treatment. Now, the interesting thing is here, it was very hard to find this information, but it says here, do not administer more than 1,000 milligrams of iron per week. There you go. That's the interval that your doctor can do, possibly. You check with them. This is ferric carboxymaltose. Do not administer more than 1,000 milligrams per week, according to this. And this is the prescribing information for Ferinject. And that would take 15 minutes minimum. It's generally well tolerated by people. I'm just going quickly through these. You must put it in the vein properly. If you screw up and you put it in intramuscularly or under the skin, you can have a permanent big black tattoo on your arm, God forbid. You have to monitor your iron. It's because iron can be toxic to the body if you're given too much. You need to be careful of that. Okay, so with 1,000 milligrams of iron, according to this, 48% of patients achieved normal hemoglobin levels, increased in hemoglobin on at least one occasion. The target serum ferritin concentration, 100 to 500. You see? Not the lab values that we have in this country of 300. This is saying 100 to 500 is a treatment target for serum ferritin. 2 weeks follow-up and 6 and 4 weeks respectively for the 2 dose groups. So that's very interesting. I'm not sure where the TSat's here, but they say a minimum of 20. Yeah, it says here 20, but 20, I don't know. I've had 20 TSat, but then I've had low ferritin. Safety of Ferinject seems to be pretty good. Again, TSat above 20 and ferritin above at the very least 100. All right, I think I'll leave it there. There's not much more. They're just kind of repeating the same stuff. Within 8 hours. Oh yeah, this is really cool. I'll read this. This is basically how fast your body seems to use it. Within 8 hours of a single radio-labeled 100 milligrams IV iron, that's only 100 milligrams, that's not much, to patients with iron deficiency or renal anemia, most of the radio-labeled iron had cleared the circulation and distributed to the bone marrow, liver, and spleen. Within 6 to 9 days, the radio-labeled iron was incorporated into the red blood cells. After 24 days, iron utilization was 91 to 99% in iron deficiency anemia and 61 to 84% in renal anemia. What I take from that is it seems to work pretty fast if you get IV iron. All right. That should do. 17 minutes. Thank you. I hope this helps somebody. It helps me. Remember to like, comment, and subscribe. Teach us out. Take care, guys. God bless.